Good morning, everybody. I'd like to thank you today for attending today's webinar. This is session 2 for PEBB Benefits 24/7 for state agencies and higher education employers. A little housekeeping before we get started. All attendees will be muted. Even if the program allows you to, please don't unmute yourself. To ask questions, please use the Q&A feature to submit your questions. And for today's session, questions should be related to adding a dependent with disabilities, adding an extended dependent, and a dependent verification process. Today's webinar will be hosted by Deb, Rob, and Larry. What I'm going to do now is going to take you out to the BA website. So let me stop sharing. Can you guys see that?
Yes.
All right, so I'm gonna take you out to the BA website. I'm gonna show you where the training video is gonna be. So again, this is your main source for the training. These sessions here we're holding today at 10 and 2 will be, as you can see, a Q&A feature of Q&A question and answer session for you. So if you want to do is go out to the BA website. You want to drop down to training resources. Once you get to training resources, you want to go to training materials and recordings. Look under benefits 24/7 instructional videos. And here's session 1. And here's session 2. We'll cover session 3 next week. But for this sessions here, for today, we're doing session 2, adding a dependent child with disability, adding an extended dependent, and completing dependent verification process. Now, for those who have viewed session 1, we're going to ask questions about those too. If you want to ask questions about those, you're able to do that. But again, just ask questions about session 1 and 2 for today's session. If you're having trouble logging in, what you want to go through is go to the HCA support and submit a request to say, hey, I need help logging in. And also too, remember when you log into these sessions, once you get logged in, no information will be there. You want to go out there and start practicing this. You want to create your employees. You want to add dependents. You want to add an extended dependent. You want to add a dependent child with disability. You want to do these things, get some practice doing it before it goes live on May 8th. Rob, Deb, do you have anything to add to that?
No, we have been getting, well, actually, I should say yes, because I did want to say that we have been getting a lot of HCA support tickets for people who aren't from state agencies, maybe higher ed, right? So you would need to be logging into that top purple button in the login screen, and then you're going to have to create a SAW account with your work email, even though you already have a work email SAW account, because that SAW account access page is a test environment. It won't recognize your general work email. So just make sure you set that up in there, and then you should be able to access it. So we've been getting a lot of questions about that, because when we did the original logging in video, we were not aware that the test environment was not recognizing people who already had an account with a work email.
There is a question out there, Deb. What do you think about that question there?
Once we verify a dependent, do we upload the verification documents? We'll probably cover that when we're going to go ahead and walk through that. And the video is, I think I did indicate that if you as the BA are going to be the one entering the enrollment for the dependent from paper documents, chances are you have a paper dependent verification form as well. You would not need to upload those. When you do the dependent verification, you're going to be able to just look at that like you currently would in Pay 1 and just verify it. So not always do you need to, will there be an upload? And your choice, again, I guess if you wanted to upload them, you could, but just know that they're not going to be in there forever. There's a timeline that they will be in there before that they are removed from the system. Any updates on changing personnel data, such as changing the name if the employee has a legal name change? Larry, what do you know about that? Anything?
Well, it depends if it's, as Andrew was talking about, somebody who's HRMS or working for the community colleges. once you update the information in your systems, it will migrate over to benefits 24/7. So if somebody has a name change, you would update it in your system. And then the next day we'll update it here in benefits 24/7.
Okay. I have, they don't have a feed. Well, the people in the audience today, not everybody, because we're doing state agencies and higher ed. So not all of them, like the four-year colleges, don't use like a feed system. So they would just be going into benefits 24/7 and changing an employee's last name.
Yes, if he's higher ed, like the 4-year school, but anybody else, state agencies or community colleges, you change it in your system.
Okay. Okay,
Which is no
great.
different today. We would pay one.
Perfect. Okay, great. Okay, Shannon, when will agency to agency transfers be covered? So that looks like Larry has the screen up right now for the training video. Session 3 is going to be next week. That's going to cover these special open enrollments and some managing BA access and employer contacts in the system. Transferring will be the following week videos. Will current employees be ported over to benefits 24/7? That is our understanding, that when the system goes live, that all of the information for those employees is going to migrate over to benefits 24/7. I wouldn't say all, but no history will come over, but their general information, their benefits, all of the information that's loaded in there is supposed to be coming over into the benefits 24/7 application. Do you know anything else about that, Lair, that you want to add?
Nope, that's all I've heard too. So anything
Okay.
that's in pay one today will be migrated over to benefits 24/7.
Okay. Tara from DOT, you've been playing around in the training environment, and this might be going back to the first session, but I didn't see it mentioned. When adding an employee, the system automatically chooses the coverage effective date based on date of eligibility. How does that work for returning seasonals who start mid-month, but should get benefits effective the first of the month in which they work 8 hours, not pushed to the first of the next month? So that is going to be in a video where we are going to show you how to restore eligibility, and it will work very nicely, but we're not going to touch on that today because that will be another session as well. Lena, can you remind us what the date is for our last day to key physical forms in pay one? There, do you know that date?
The date that I know of is May 8th, the day before. So probably that Friday before is probably the last day, but we don't have an exact date on that yet. So I don't want to say exactly, but that is a plan. Be May 8th is the last day.
Okay.
Pay one access will go away.
Okay, great. Any more questions? Okay, it doesn't look like there are any questions, Laird. Do you want me to go ahead and just do a demonstration of what
Yes,
was
please.
in those videos? Okay,
Yes,
this
please.
really shouldn't take that long. It might be a repeat for some of you who have watched the videos. I apologize for that, but we have been finding that it's been nice for people to we walk them through demonstration wise and then allow them to ask questions. So because we do have this 2 hours allotted, we are going to go ahead and do that. So I'm going to go ahead and pull up my screen. And Lair, can you tell me when you can see mine?
I can see it.
Okay, so as you can see, I'm already logged in as Department of Ecology BA. And so what I'd like to do first is go ahead and take a subscriber that I already entered into the system so that I would have one to demonstrate. And I have not done their newly eligible wizard. I haven't gone in and enrolled them yet. So I'm just going to save that. And while I enrolled this employee within that newly eligible timeframe, I was going to go ahead and add a dependent with a disability and an extended dependent. And then we will pop over and show you how to do the dependent verification. So I'm going to go back to the manage subscribers, and I'm just going to go find the employee that's already been added. So I'm going to say we're working with Marilyn Monroe today. So I'm going to go ahead and manage that subscriber. And as you know, to do their enrollment, we'll just go ahead and walk through the wizard. Again, this would be if you got paper forms and you're doing it for your employee, or this is what your employee is going to see when they go ahead and try to add their dependents and do their own enrollment within this 31 days. So we'll go ahead and click on the newly eligible wizard. And it's just saying, do you have dependents? And we're going to say, yes, we do. Click on next. And again, here is all of the information about the dependents. There is a little bit of information here, right here in the narrative, that when you're adding a dependent with a disability over the age of 26, that they're going to need to provide some additional information for certification. So that could very easily get missed by your employees, right? So I'm going to go ahead and add, let's see, I don't have any names. How about first name David Monroe, and I'm going to give a birth date of, let's see, what would be a good birth date so they show up as 26. How about 1996? And we're going to say male, and the relationship. So here's what, you don't have to tell the system that this is a child with a disability. All you have to do is say, yep, this is my child. And the system is sophisticated enough to read this state to recognize that this has to be a dependent over the age of 26, and therefore they have a disability, because the only way you can enroll a child over 26 is if they have a disability. So we'll go ahead and on this one, I will go ahead and give a social security number. And when I said that this was a child, so let's say I'm going to go back and say spouse. There's nothing here. So, but when you tell the system that it is a child and it recognizes that it is a dependent with a disability, starts to drop down some more information. So this is where it's going to tell the employee and you as the BA that this is a dependent with a disability, age 26 or older. Here is that certification form. So just like the video, I'll go ahead and click on this. I'm going to, I'm going to download it, bring it up. Okay, so the video was, we wanted to also spend a little time on this whole educational part of this form for certification, because our team at HCA says, a lot of employees and a lot of the BAs aren't really clear on how this works. But when a subscriber is enrolling a dependent with a disability, not only do they have to provide verification that that is their dependent, but they do have to get this certification form completed. So it is the employee's responsibility to make sure that all of this is completed and sent to the correct address within that 31 days. Otherwise, this dependent cannot be enrolled, or there potentially could be appeals that you'll have to be going through. So this information is on the form. It tells the employees what they have to do. They have to do their enrollment, and they have to complete this form within those 31 days. It also tells them where to send the form. So if they're going to enroll this dependent with a disability in dental only, then they would go ahead and send it here. But if they're going to go ahead and enroll the dependent in medical, and that's with or without dental coverage, it's all going to depend on which medical plan they've selected. So if they're Kaiser Northwest, it would go here, Kaiser Washington here, and if it's uniform, it would be here. And then again, they have the responsibility of making sure all of these sections get completed. And that's going to also include working with the dependence provider, medical provider, to to make some statements here about this dependence medical condition, so that when it gets sent back to where it needs to be sent to, they have enough information to certify that, yes, this dependent does have a disability and therefore meets eligibility to be enrolled into the PEBB insurance. So I guess the message here is just, please make sure you work with your employees when you recognize that they have a dependent with a disability, because our intentions are to be sure that these dependents get enrolled timely. So, okay, so I just wanted to bring that up, that form is there and there's more information there. So I will talk about this area later, but we're just going to say that the address is the same for this dependent as it is for the subscriber. It's just going to ask us to add coverage for this dependent. And in this situation, we're going to go ahead and pick medical and dental. So that would just mean they would send the form to the medical plan that they have elected. And again, the system recognizes that this, based on the dependent's age, that they are going to need to attest to the tobacco attestation. So we'll go ahead and do that. And it provides some information. We're just going to say, no, this dependent does not use tobacco products. And now we'll go to the dependent review. This is where you and the employee would say, yes, here's the employee's, the dependent's name, birth date, they are a child, they are being enrolled in both. And the system is sophisticated enough to recognize that no tobacco and that it was not a spouse. So therefore that didn't apply. So we'll go ahead and finish this dependent. It's asking, do you have an additional dependent to add? So I'm going to say yes, because I now am going to say this subscriber has an extended dependent. So again, we will go ahead and give this person a name. How about Ben Evans? Because this is an extended dependent, and we're going to just say 1/1/2000. Oops. Okay. And we'll say male and male. And here we're going to say, this is where you get the opportunity to be clear that it's an extended dependent. Again, once the system recognizes that you're adding this kind of dependent, it's going to already put the qualifying reason as an extended dependent, and it's going to drop some information down here too, saying that if you have an extended dependent, that you have to provide this certification form, and that is going to be required as well as the other the other documentation to prove that this is an extended dependent, and we will get to that in just a second. But I'm going to say I don't know the social security number of this child, so I'm just going to say don't know it at this moment. But this dependent is going to be residing with the subscriber, and we're going to add coverage to this extended dependent. I would like to go ahead and elect both. Again, based on, oh, I must have given it a date that wasn't good. I apologize. I need to, because I don't want it to be somebody who's 26.
No, it's not.
It's not?
No, it was 2000, so 23.
Oh, it shouldn't be asking for a tobacco attestation. So I would like to apologize that this came up, because if that dependent,
13.
huh?
Oh,
you know what? Thank you. I had it confused with the disability. Yes, the tobacco is correct. Please erase what I just said. Okay. Thank you, Larry.
Mhm.
Okay, so we're going to say no, they don't, and we'll proceed to the review. And again, here's the dependence information. It recognizes it as extended. It's going to be enrolled in both. And again, neither of these apply. So we'll save and finish this dependent. And we're going to say no more are going to be added. And so here's where you can do it's just comprehensive review of those two dependents you just added. And it's just saying the exact same information. So we're going to go ahead and upload eligibility documents. Okay, so first, on this page, which is very different than just adding a spouse or a child, it's going to bring up this pink box, and it's going to tell you, or the employee, that that certification of a dependent with a disability should not be uploaded here, because again, that form does not come to you or to HCA. It goes to the address that was on that form. So we just want to be very clear about that, but that they would still have to provide dependent verification documents for this type of dependent. So we'll go down here, and we're going to go ahead and upload. So we did have a question earlier that said that, can you do the dependent verification without uploading a document? Yes. So if you are the BA and you have the papers in your hand, you could just click on this proceed to elect coverage. You could just kind of bypass this. But if your employee is doing it, they would have to upload these, because that's how you would be reviewing it. So we'll go ahead and select the files. So for the first one was the dependent with a disability, I'm going to go ahead and pull up the birth certificate for that dependent, upload that, and it uploads here and down here. So it's asking me, what is the document type? I'm just going to say a birth certificate. And this is going to go to David. I think that was the first one. So I'm just going to say this verification applies to this person. And then I'm not going to confirm this yet, because I want to go ahead and add documents that I want to send to, HCA for my extended dependent. And we know that we need court documents for that, and that we also need this certification of extended dependence. I'm going to just go ahead and bring both of those up. So that's where it's different. The certification form for an extended dependent does come to the upload or to you to verify. Well, not for to verify, but I'm sorry, can be uploaded here for HCA. So it's just saying, what is this document here? Well, this is, right now, we don't have an option for the certification of that extended dependent. You can go ahead and use this court-ordered parenting plan or legal custody or guardianship option. And when you get to the court document that's also needed for that extended dependent, you can choose the same thing. And you're just going to say, well, which dependent does it apply to? Both of these apply to this dependent as an extended dependent. And we'll talk about how this gets verified through another process that you really aren't involved in, but it's going to be more of an FYI for you. So we'll go ahead and upload that. Here's where the system's saying, okay, we've confirmed that you provided the information. Does not mean that these dependents are enrolled, though. We just are confirming that the proof has been submitted. So we'll go ahead and elect coverage. So when it says elect coverage, remember, we did not enroll this employee yet. So this is where the employee is also going to go ahead and enroll their coverage. Ooh. Well, okay. Well, I was going to select classic. Maybe I already did enroll the employee. So sorry about that. And it's going to go ahead and say we've selected the dental. And it's going to bring up this confirmation of what you're doing here. So the coverage effective date, this is interesting. It's not loading all of the information here. It should. It'll be something that I report back to our development team. But the coverage date would be 5/1, and the medical and dental is correct as I've elected it. So now we're going to go to the tobacco attestation, and this is going to be for the employee. Remember, we did the other ones if they were required for the dependents. So we're just going to go and say, Wes, we know that maybe she probably did have a cigarette or two. Legal notice. Next, we'll just go through that. And this is saying you'll be charged the $25 tobacco surcharge. So now we'll go on to the supplemental coverages. And I'm going to go ahead and leave this employee defaulted at the 60% plan. And continue and review. And here is the summary of the coverage. So it got it on this one, where it didn't on the previous page where you were looking at that. And again, I will talk to our people about that. But it is showing that both dependents are here with an effective date for medical and dental. Here, it has the premium. It shows what plans they're enrolled in. We'll go to the next screen. This is just the other coverages. And then this is where we're going to go ahead and confirm that. So now that you've got them enrolled, let's say you are you're doing it as the BA. Well, when you go back out to the dashboard, you're going to know that you have to come in here and do some dependent verifications, right? And that number there is going to be what tells you have some verifications hanging out there. And something that I think I've said in the previous webinar or videos is that as a BA, you want to be getting into benefits 24/7, probably daily, because if your employees are doing these enrollments and uploading their documents, this is the only way that you're going to know that they're uploading something for you to verify that number right there. So it's saying that you have that. And also, when you're doing the enrollment for them, it just makes great sense to immediately go out and go ahead and do this dependent verification. So either way, so we'll go ahead and click on the dependent verification. And as you can see, this is going to bring up just what's out there pending. So I think that tile said, I can't remember the number, sorry, 13. 13 things were out there. Here are all 13. There's 2 pages of them. But I know that I want to go look for that employee. So I am going to go ahead and just do, instead of going through pages, because maybe your agency is going to have a lot and you don't want to page through it, I'm going to go ahead and look for the subscriber. This is how I can filter this. I can type in the name contains this and go ahead and filter that. And it's going to bring up just the one. Here is that dependent showing that it is a dependent with a disability pending certification. So just a couple things that I wanted to say is this pending certification. I'm going to go back and take this filter out just for a minute. Well, I'll just do this. Okay. If you look at this page here, everything looks like pending. And then you have pending certification. So if it says pending certification, chances are that's because it is a dependent with a disability. You know that you don't certify, right? You don't certify this part of their enrollment. We do, or somebody else does outside of the benefits administrator. You won't have any part in that. So just so that you know, if it shows up that way, it's just because it is somebody who had to have a certification approved. But if it's showing up here on your page or your tile, it still means that you have to go in and verified their dependent status. Once you've verified their dependent status, then this whole thing will fall off. So regardless if it says pending certification or pending, you would need to be verifying the dependent part of that. So I will go back in and find her again and open this up now. You just click to the left of that or on the plus, and it's going to drop this down. So the first thing you're going to see is the subscriber. Here's all their information, their name, social, and their date of birth. Here's their dependent. Here is their social security number and their date of birth. So for you as a BA, when you're doing your verifications, let's say your employee uploaded this and you didn't know it was coming. Well, you're going to see that the relationship qualifying reason is that it's a disabled dependent, 26 years or older. So you know that you're going to have to be looking at this. And this has just got different text, right? But I'm going to open it. It looks good. The dependent information is there, and I can go ahead and verify that as a dependent. And I'm just going to say verified, the date and the document type is right here. It is a birth certificate. And I already know that because I looked at it. Now, if you get something that does not show that it's a dependent, right? It's not the right document. You can deny that. And if you deny it, you're just going to say it's been denied, or you're going to say the reason. You're going to put the date and then what type of whatever document type. Just select what, it doesn't really matter because it's not the right one. So when you hit submit, it's going to stay out there as denied on your pending on your status, and then you'll know that you're still waiting for something. But just know that the system is not going to notify your employee in any way that this was denied and therefore you need more information. It doesn't allow you anything to tell them. So that's how it works today with Pay One and how we do things. So if your employees don't submit the right documentation, you have to deny it or just leave it as pending. Go out and let your employee know so that they can get you the information you need. If you deny it, it just tells you it's still hanging out there. That would be your first clue that maybe you want to keep reaching out to them. If you leave it as pending, it just means you might have to go back in there and keep checking it and forget that it was denied. So it'd probably be a good idea to just go ahead and deny it so that you know that it's waiting. But I'm going to go ahead and verify that and submit those changes. Oh, sorry. And now they're not going to come up anymore. That record has been verified for your responsibility, and it just drops off because now that certification part goes over to our team and we will take care of that. So it will no longer be on your tile. So if I take that filter out, let's clear it, you'll see that there's no Monroe here or on the second page. So she doesn't show up because you already did your part. So we're going to say, though, that we would like, so that's how you do that part of it. For an extended dependent, these won't show up on your tile either. So we're going to look at the reason, right? So you have a dependent not disabled, not disabled. You have a dependent's not disabled, a married spouse, dependent, disabled, dependent with a disability. And so you don't see anything here about extended dependent. And that's because you don't play a role in any part of their verification. But for me, if I was a BA and I was entering it, I would be checking to make sure it got there so that the HCA people could go ahead and do their part. And how you can do that is you can say it's not a pending because it's not your responsibility. You can unclick the pending. And you can go down here and just say, well, let me find everybody who's got an extended, right? And you're going to see that Marilyn Monroe does have Ben that she added as an extended dependent and is pending certification. So that you will not see except for if you unclick this just to see, this just tells you it got there and our team will be working on it. So that was kind of all I really wanted to show you. So the other thing that I wanted to do now was go back into the employee, search for her, and now manage her, because as the BA, you can come down to their manage dependents tile And you'll be able to see both of these dependents that have been, enrolled, or once they're certified, they'll be fully enrolled, but it will tell you their status, right? It's not pending. If it said pending, that means that you still have to go in and verify the dependent part of that verification. But if it says pending certification, that's our side. So I'm going to go ahead and open up this dependent, and down here, down through all of this at the very bottom, you'll see this little certification. This is where our team is going to go ahead and update the status, if there's a review date, if there's a start and end date for this type of certification. Right now, it's telling you, if you have questions about this, go ahead and send us a ticket through Fuse. That will be changed. That needs to say HCA support, or you could call this phone number. And a lot of times your employees may come to you asking, when do I have to do my next certification? This is where you would find that information. Also know that your employees, when we go to their dashboard, they can come down, because this would be their dashboard. They could come down to the Manage Dependents tile for themselves. They would be able to see the exact same thing. I went in yesterday, tested it from the employee side, and they would also be able to see any of that information. None of this can be changed by you or your employees, because remember, that is an HCA function. So that's what I wanted to show. Any questions, or Larry or Rob, did I miss anything important on that would be helpful?
I didn't see anything. Rob, did you see anything?
No, I didn't see anything either.
Okay. Kristen, for higher ed, I saw we enter zero pay for employees, but they will still be selecting their LTD option in their screen. Also, they will be automatically enrolled in MetLife, or do we still need to send an enrollment form to MetLife? So I'm going to take part of this, and I'm going to let Laird take part of this. So a higher ed, let's say South Puget Sound Community College. I'm going to go in and look at somebody. Hopefully he's still active and I can look at that. Hopefully nobody termed him. Oh, good. Yay. Okay. So on that supple, where's the dashboard here? He doesn't have a wizard. Okay. Let's see. I need to find one that's still good, because I understand what you're saying from a higher ed. On there, when you bring them in, we have been saying you can go ahead and say their salary is zero, because you guys as employees do not do enrollment for LTD and the benefits 24/7 application. So I've been sending in some Q&As to my supervisor who's working with our development team. And one of the things that I just learned this morning is that if you put the employee's salary here from a higher ed, if you go ahead and put them in, when they get to that supplemental page where they still have the ability to, and it's hard because I don't have the wizard, but it will allow you to do the 60/50 or decline. And it has that nice little formula there where it would show their salary, and then whatever for the 60% plan, it would be this rate. Here would be the premium. Here would be the potential benefit. That, if you want your employees to be able to use that, then you would need to be putting in a salary, because really the salary is the only thing that's used is to show that tool. It's misleading right now though, because your employees are not making their LTD benefit elections in benefits 24/7. They are doing that through, I'm guessing, a paper enrollment on your side. I have had some higher eds reach out and say, hey, now that this is out there, if we wanted to keep that salary updated, that would be kind of cool. They liked that tool. They liked the idea that the employee could see what it meant and how much they'd be paying and what their benefit would be. But how come we can't let our employees use it? I don't have an answer for that. We are in the middle right now of deciding, should the LTD stuff just completely be off of this page for higher ed employees, leave it, tell you to put a salary in so your employees can at least see it, but then you have the responsibility to make sure they know that their election is still through you, not through us. So we do have some discussions about that. So right now I've also, and I don't know, Larry and Rob, if you have been updated on this, but I have been directed to tell all employer types to go ahead and put the employee's salary in here. But then there's the other question. What about keeping it updated? For people like our higher eds who are doing their own LTD and our medical only groups, all that's going to do is show people on that screen, that LTD screen, that this is what the premium would be and the potential benefit. That's all. And if you want that, then you would have to do that. So as long as they have an accurate salary, then that would work. But you do have the onus then to go ahead and keep this updated. If people wanted to come back in and use this, to look at what that premium would be, it would not be right if the salary was not right. So it can be very complicated. Larry, what else do you want to say about that?
I'm just saying how you handle it today is the way you're going to handle it when 24/7 launches. So today, do it the same exact way. Don't change anything as far as how you do with life insurance and long-term disability. If you want to choose to come up here and update that salary, that's up to you, but you don't have to do that.
Larry, so Jeff asked me yesterday to be sure that everybody's putting in a salary.
But if they don't update it, I mean, you could say that. If they don't update it, what are you going to do?
I agree. And so I know you and I've had discussions about that. I just, put the salary in. I like the 0 right now for the higher eds, because then when they do get to that screen, it doesn't lead the employee to believe that they're going to be enrolled in that way. They need to be enrolling through their employer. So I think it's an internal discussion that you have to decide what you're going to have with your employees to make it work until changes get made one way or the other. Okay. Will the system send the BA an email notification telling us that we have a new dependent verification document to review from our employee? No email. That's why you have to be logging into the benefits 24/7. I would say at least daily. That would be my recommendation, because that tile is where it's going to come up. Will HCA contact employees and ask for a social security number after 60 days? No. In fact, I'm sorry. I probably should have brought that up on the...
Well, hold on.
Go ahead. I'm
HCA
sorry.
does contact employers when a social security number is wrong in the system and it's not matching what IRS has. So our department, James's department, will contact the employers. I'm not sure exact date, but they will contact employers and say, hey, you need to update that social security. How it is done today. If they do it today, it's going to be the same thing they're going to do when 24/7 it goes in effect.
Thanks, Larry. I'm sorry. I should have thought about that because I forgot. I guess I wasn't up to speed on really what that process was. And I'm going to go back to this one dependent because I did want to show people this. Okay, so this one that I entered, remember I put no social security number. So let's say this was not an extended dependent. It was just a regular dependent being added. You were coming in to verify it. And when you see this right here, that social security number is system generated just like Pay One does. So when you see that, that's how you know that they don't have a social security number. Part of my conversations where I did speak to my supervisor about the fact I knew there was something that HCA did. And he said, please share the message with BAs that if they see this, to please try to work with their employees to let them know they should go ahead and get that back to us, that information, as soon as possible. So I'm going to go ahead and share that just because I was asked to share that. So, but yeah, Larry's right. At some point, we'll notify people. Will there be a report for missing social security numbers? And will there be a report for enrollments not finished within 31 days of eligibility? So do you know anything about this, Larry? Does this happen now?
Well, so Rob, when SEP does that today, does there a thing saying anything at all, report saying that if somebody didn't finish the enrollment?
Yeah, currently in my account, we do have 2 reports that are available to BAs, dependent with temporary SSN by district, and then another report by statewide. So those reports are available. I'm hoping that they'll transition those over to benefits 24/7.
And Larry, I just pulled up from the reports tile, this right here. It looks like it's going to be able to show a dependence without social security number for an organization. Right now, I'm not able to run the reports, but it looks like there's something designated for that. That would be kind of a nice tool for people. And then the enrollments not finished. So I'm assuming that the question relates to like the default. And I don't know about that. Like, let's say they default and the employer wants to know, maybe for like payroll purposes, will there be a way for them to know, like, remember, we've been talking about this anyway, like how do BAs know when there are changes being made when it doesn't come through them?
Rob, is there any report set that somebody defaulted, or do they have to just wait till the invoice coming, or how's that work to do?
There is a report in Set My Account currently. I hope that also transitions over. It's called the default benefit elections. So yeah, you won't get notification that an employee hasn't elected anything in their 31 days, but as a BA, you should be able to go in and pull this report if that's available in 24/7.
Yeah, that makes sense. Okay. Jacob, will employees still get a letter in the mail from HCA when they need to recertify?
Yes, 90 days before they need certification, we'll get a letter from us along with the form. Tell them they have to certify that dependent. Yes, that's going to continue.
Thanks, Claire. Andrew, some employees in the past have said that they mailed in the required annual docs for extended dependence, but paperwork was never received. What is the best way to send that in? Should they send it in via certified mail?
So we were having problems with people filing those extended dependent forms in the wrong categories. And so people weren't reviewing those. So that's something internal that they have addressed. And hopefully from the future on, they will be start putting in those in the right queues. And so they'll be processed in a timely manner.
Thank you. Okay, so Michael, we have too many employees to update salary in 24/7. I'm guessing that's a higher ed employer. And yes, I would understand that. So right now it is your decision whether you would like to do that or not. When the standard LTD carrier asks for the enrollment form, we would need it to submit for LTD claims. Larry, I understand, I think what this person is saying for the claims purposes, that they need the enrollment form, but let's say it's not a higher ed that keeps those, right? Say it's a state agency that now their employee is going in and making their own elections. There won't be a form to send to standard. True?
Well, usually what they do is for the forms, when people submit it and stuff, they do, send that form, but I don't know how they're going to do that. So it's something that we're going to have to go back and ask about that one. I don't know exactly how that's going to work. I don't know if there's going to be a report that we run and give it to standard. I don't know that answer to that question, but
Yeah,
we will try to find that out.
Thanks, Claire. I do think that's a good question, though. Okay, higher ed LTD. So Eastern and Central both have faculty LTD plans that the university pays the premium. So I would vote for leaving it off for higher eds. Okay, we'll just send that back up.
Yeah, me too.
Yeah, me too. Okay. It has been mentioned that when employee salary changes, we will need to go in and update the salary. For state agencies that have info feeding over, will that monthly salary update on its own? Yes, it will automatically. State agency employees do not have to, employers don't have to worry about that. Right, Lair?
You're correct.
Okay. I missed if they would be automatically enrolled in MetLife or we need to still do paper forms.
I would do paper forms. I would do paper forms. And the reason why I would do paper forms is because it takes a little while to get into their system. And when people try to go out there and go and access the website, they're not going to know about that employee until like a week later. So in order to get that information, I would do the paper form as it is right now until something else changes, because right now I would definitely do the paper form to start out with it.
Okay. Is that for basic as well, Lair?
Well, basic, you still have to do, I mean, you can wait basically, but you can wait because all you're doing is go out there and, electing your beneficiaries, right? You're not asking for additional coverages. So you could actually wait for that. But for people who want to enroll in additional coverages, send the form in. Perfect.
Thanks, Larry. That's going to be regardless what kind of employer you are, right?
Mm-hmm, absolutely.
Okay. And when will we cover dual enrollment? That is coming. I don't have the date on that. That was not originally part of these, just getting started, but we do know that there is a need for that. It has been added to our list of videos to get covered. So here's what I would like to say. We aren't before we go live, going to be able to demonstrate every single part of the functionality of benefits 24/7. We are trying our best to identify the things that, we know that the majority of our employers are going to need to use to get in and start running. You will run into things we have not covered, and you will potentially run into an issue here or there. When that happens and you don't know what to do, please send an HCA support ticket or contact our 1-800 number. And a benefits guide will be coming out. Benefits administrator user guide will be coming out at some point too. But it may or may not include all of those details. Please just reach out to us, because we are not going to be able to cover it all before we go live. We're going to do the very best we can to hit the things that we get asked about. And again, if you run into something that's problematic, let us know. Does anybody want to say anything else about that?
Nope, that sounds good.
Yeah. So does anybody have any more questions about those first 7 videos? And that would be logging in, just a general overview, the adding a subscriber, enrolling dependents, enrolling a dependent with a disability or an extended dependent, or that dependent verification process. Or maybe something more general that's not those topics that we're going to be covering in the future. There's a lot, but I hope the videos, are helping at least to be more clear. Can you go over again how to get to the training videos? Sure, I will go out to the PEBB Benefits Administrator website. So regardless which type of employer you are, when you come down the screen, you're going to see our training resources. So you're going to go click on the screen button. And in this little box right here where it says need training, you're going to come out to the training materials. And under benefits 24/7, here are our videos that you can start watching. As you can see, next week's videos are already rolled out for the special open enrollments, how to manage that BA access in the system, and then manage employer contacts in the system. Also for benefits 24/7, I'm going to go ahead and close this up, but you can see that we have some recorded webinars, and these are just webinars that were out there, we did last week. So say somebody wasn't able to attend and thinks that they would like to go in and listen to that, what things we covered, that will be out there. You can look at those, and we'll continue to post those each week too, because you might not be able to attend all of them, and there might be some really good helpful information in those that can help you. Okay, are there dates set yet for go live and pay 1 cutoff? Laird, do you want to just say that one more time? Somebody might have missed that.
Yeah, so the dates for cutoff is probably the Friday before the 8th. But the 8th of May is when we're supposed to have the 24/7 go live.
Okay. And Kristen, will we still be precluded from keying during state share dates each month? That's a great question. What do you know about that, Lair?
They haven't decided that yet, but I don't think there's going to be any limitation on that. But we need to ask that question just to make sure.
Yeah.
Because right now there's like 2 days a month when they're not supposed to be keying. I think what they're doing is they're holding that information for those 2 days. Even though you key it in the system, they're holding it and then process it after state share runs. So right now, I will find out the answer to that question.
Oh, that would be really nice, wouldn't it?
Mhm.
If it did that, it would be great for the BAs. So they wouldn't have any limitations. Let's hope that's the answer. I think one more thing I would like to say is that, so during the webinars, people are sending us questions. We're doing our best to answer them, but we are coming back and, we're compiling it all because we can run reports showing the questions you asked. And what we're doing is sending those on to our supervisor and the development team. And as we get questions for those, we just want you to know that you have been heard. They are developing an FAQ that will be coming soon out on the PEBBA website. And I'm guessing that as we continue to get questions that people are asking, that they will continue to update that. That might be an additional resource here soon that you're going to be able to go in and look at to see if, I think they kind of had that infused too, didn't they? Where you could kind of go look up a topic or something, Larry?
Right. Mm-hmm.
Yeah. So it'll just be a different way, but over time, there will be a database like that of some sort for you to be able to go out and find, ways to get these questions answered while you might be waiting for like help from HCA to answer maybe a support ticket or something. We're trying to find as many ways as we can to like help you get your questions answered. Do you anticipate many changes in the 035 reconciliation process? I don't know what that is. What is that, Lair?
I don't deal with that at all. We'll have to get an answer for you. I don't deal with that at all.
Right.
That's more of an accounting thing.
Okay, thanks. Anything else? We're happy to help if you have any questions. Okay, for LTD, some employees are only eligible for basic if they're hired for a specific reason, such as a WASDOT winter temporary employee. It is clear on the is it clear on the LTD enrollment page if an employee is not eligible for the 50 or 60%?
So it's handled the same way it is in pay one. The status when it comes over for the type of employee, it'll show them and they won't be eligible for the long-term disability. So it's going to handle the same way it is as in pay one when it comes over from HRMS.
Okay. So if they're temporary and they're not eligible for that,
Well,
I mean,
we're talking about like seasonal employees, less than
Yeah.
9 months, and county commissioners or whatever the other ones. Those are the employees that they're talking about.
right. Okay. So yeah, I haven't done any of those in the test environment. So okay.
You would
Cool.
leave that one alone, yeah. But
Yeah.
that's what we're saying they're going to do.
Okay, great.
Same way
Thanks,
it's
Lair.
handled today.
Okay, thank you. I'm trying to figure out how to add a dependent after establishing someone, such as someone deciding within the 31-day window that they want to add their child after all, but do not seem to be able to add the dependent. Oh yeah, okay. I don't know what I'm going to go ahead and demonstrate one. Maybe I got to just find somebody who has a wizard still, and who that would be maybe would be like this Marilyn Monroe. So let's say this employee, I'm going to go ahead and manage them so you can see. It's kind of what I already did. So they still have that 31 days, right? 418 to 520. And then you as the benefits administrator, once 521 rolls around, this will go away for your employees. But if you have paperwork that they've given you and it's just sitting on your desk and you don't get to it until like the 25th of May, this wizard will stay out there for the lower limit period for you as a BA. So you can always go back in. So they've gone in, they've made all of their elections, and they can change this as many times as they want. So when, let's say, oh, I forgot to add her husband. So I'm going to go in, or she didn't have maybe the dependent verification documents to upload. So she said, oh, I'm going to just add these. I got to go back later. So she can come in on another day as long as she's in here and she can add it. And basically, here's what's saying. Do you have additional dependents to add to this account? And we would say yes. Click next. And it's this where she could add her spouse. And we'll just do one. I will add one. And I can't remember how old I made her. Is she marrying up or marrying down? Let's see. Maybe 1960. I don't care. Okay. We'll say male. Male. And this would be her spouse. And it's asking for that marriage or partnership date. So we'll say January 1, how about 1988? And we're going to say this is a spouse. And here's their social security number. They live together. We'll add coverage. So you should be able to go ahead and add their coverage. And again, it recognizes that it needs to do this surcharge. We're going to say no. Oh, so here's, we probably already went through this when we were adding it, so I'm not going to walk you through this, no big deal. But this is where you would do the spousal surcharge attestation and saying, yep, we're going to try to do that. Add this. And then it just says you have successfully added this person. Do you have more? And we're going to say, nope, we don't have any more. Now it's going to bring that comprehensive dependent review. So these are all the dependents that this employee has added. So a spouse, and then that child, and then that was a child with a disability, and this was their extended dependent. And you can see that they're going to be enrolled as well. And go here. And again, if the employee is doing it, then they could go ahead and upload their document. If it's you, you could just skip through this, but I'm going to say it's a tax return. Go here, loads that tax return, come down the screen. It's saying what kind of document is it, tax return, and I'm going to say that is verification for my spouse. Go ahead and upload that. It's confirming that. it's still going to let me because I'm in my 31-day window. I might decide that, hey, I'm going to go ahead and put us on the Kaiser plan. It's just saying, remember, you have a child with a disability, make sure you get that certified because you're changing the plan. And maybe I say, oh, I would decide I'd rather have Willamette. They can do that. They can change it as many times as they want in that 31-day window. And then it's just saying, okay, oh, here it did a nice job. It pulled them all up this time. So here they all are with this. Here's the new plan they chose for medical and dental. Now, here's what I would like to say. When people go back into the wizard, just make sure you go all the way through the end of the wizard. Here's all the steps, right? You got to get to this confirmation page. Let's just make sure it all gets saved. So we're just going to keep going through. We're going to say, yes, this subscriber uses tobacco. Go through that. And because the subscriber does, they're going to get that $25 charge. Now, this is the stuff I was talking about earlier. So this is a state employee. So they can go ahead and decline right now. And again, within that 31-day window, they can come in here and just change it as much as they want, depending on which one. And it's telling them, like I said, their salary, this is the rate. Here's the plan rate for 28% for 50% plan. $14 premium, here could be the potential benefit. I'm going to go ahead and leave it at the default. For you higher eds, if you say 0, this will just not give any misleading information, right? And it doesn't matter what they put here because that is not going to drive their enrollment into long-term disability. So we'll go here. And you can see now that they've all been added. They've changed their plans. Here's the premiums and those effective dates. And next, and we left all this the same next. And this is the part that's really important. Step 6, go ahead and confirm that. So I hope that helped. Okay, so going back up to, you remember, you'd want to come up here. You're going to go to that dependent verification tile. You're going to go look for this employee right now. So you can just get this all done, get it off of your desk. And you don't have to worry about this one. Filter, we see she added a spouse. I'm going to go ahead and open this. I know I'm not going to open this. I know it's good. I'm going to go ahead and verify it. Verify here. It's all good. And it is a tax return. So we're going to go ahead and submit that. And now that dependent is fully enrolled. So that's the process. I hope I answered your question. I don't know if maybe you were missing a step or try it again, see if it works. If it doesn't work and we're not on the line with you, please send in a ticket. Lindsay, as far as everything transferring over from Pay 1 when the new system goes live on the 8th, what happens to those pending verification at that point? It's my understanding pending verification will populate into the pending verification tile. You should be able to find them here. Anybody who's within their 31-day, say you entered them and they're still in that 31-day, they will be able to come down and that wizard will populate and it will be there. It will recognize that they still have the opportunity to make elections. Anything else you guys want to say about that?
I don't.
Okay. And Shannon, what kind of issues may arise if an employee does not go all the way through the screens to the confirmation page? Their benefit, I would say that their election, if they're changing, it depends what they're doing. If they're going back, if they're doing the wizard and they don't go all the way to the end, I can't confirm that would enrollment would be accurate, right? If they're going back into the wizard after they've already started it and they want to add somebody or they're going to change this, that, or something else, if they don't accept that, as the legal confirmation step 6, we cannot confirm that they would or would not have that. That question did come up though. So I just would like to say that it might be one of our FAQs that shows up because we don't know if they do it in the middle, but here's what we're telling people, go all the way through. Okay, Andrew, it looks like the newly eligible flag wasn't letting me add new dependents because the info I was entering for the fake profile was for me. When I played around with the fake profile for just a different person, it was showing up. Okay, I don't know why that would happen like that, but okay, I'm glad you got it to work. Okay, and just remember as an employee, okay, so BAs have 2 roles, or they're going to be in the system on 2 different occasions. They're going to be in as a benefits administrator, and then they will also be going in as a subscriber, right? So as you're going to maybe have something you want to change at open enrollment. So you're going to be wanting to go in through that top purple button for the login for subscribers, you're going to have a SAW account with your personal email, not your work email, because your work email will always pop you back in as a benefits administrator. So when you sign up with that SAW account with your personal email, then it's going to identify you. You're going to tell them, yeah, here's my birth date, here's my last four of my social and my last name, and it's going to go ahead and pull you up as an employee. That's where you make your elections. And then as the BA side of it, you might have something you have to do and go in and verify it, or maybe another BA you work with does it for BAs who are also employees, however you guys do that internally. Any other questions?
Yeah, but reminding employees to use their personal email.
Employees?
Yeah.
Yeah. Okay. So I haven't done a lot of training at all on the employee side of the house. So I did in the logging in video make it clear that employees would need to be doing that, but I didn't spend a lot of time. So once this gets rolled out and your employees would like to use it, yes, they will be logging in using that top purple button. And they will have to have a SAW account to get into the application. So they will need, if they don't already have one for their personal email, they will need to create one. And then they will give that information, just like I explained to you as a BA going in as an employee. They'll have to have their last name, their date of birth, and the last four of their social security number. We'll ask them some security questions, and then they will be popped in as an employee to be able to go ahead and do that.
And the reason why I'm bringing that up, because it's really important. These benefits are personal for the employee. So it's not a work thing, it's personal. So if that employee enters their work email address and they move to another state agency, they will not have access to that work email. That's why we're asking them to use their personal email when they log into SAW.
Thank you for that, Rob. That's very true. Okay, so I got one more question. Are plans filtered out based on what is available for their area? So for those that want coverage based on their duty station location, will they be able to do this through the new system? No. So the system is going to be sophisticated enough, say that, pull up this employee again. I'll pull up a different one. I guess it doesn't really matter who I pull up. Okay, so I'll pull up this employee and it's going to come in under the eligibility, right? It's going to see their address right here, down further. Still getting used to this screen myself. And it will recognize their address, where they live. And based on that, when they do their newly eligible wizard, when they get the opportunity to select their medical plans, they are only going to get plans that are available in that geographical location. So just be aware of that. We won't offer something that's not there. Okay, was there an update if there will be a message to employees to use personal email when registering for SAW? So here, yes, they will. I don't know what you mean by update, but that Rob just answered that yes, they will need to use their personal email. And we did have, it was you, Letitia. I see that. We went ahead and forward your question about that because I thought it was a good one too, that somewhere when they're on that page to log in, it would be nice if it said that, right? So here's what has happened. Yesterday, we were in a team meeting on this and some things are starting to come out for employees. So they are developing some language to go ahead and put out on the PEBB employee website that once they try to log in, that there will be some basic logging in information. And I believe right there is where it's going to tell them that they have to use a personal email in their SAW account. So if they want to use those directions, they will be available. Yes, on the website. Yes. And you guys send things out that we're not able to answer, and we are rolling this up to the people who can make the decisions because we don't make those decisions. But I can see that some of them, are being worked on as we get them. So just know that we are hearing you, and it's all about priority. We know we have a go live date. The team will set the priorities on which, what gets done, when it gets done. Some will happen potentially before the live date, some will come later. But I guess for me, I can't say enough that we are hearing you. We are sending this information forward. It is getting logged. And so, it just might not be done in the timeline you were hoping for, or maybe us too, but we're just trying to prioritize it. We're kind of trying to triage them as they come in. Any other questions? Okay, well, it looks like we're going to give everybody about 50 minutes back to your day. And maybe you can go in and use this 50 minutes to play around or watch the next set of videos. But we really do appreciate you attending. And again, once you've watched the videos for the next webinar, go ahead and register and attend those webinars next week and bring your questions. And we'll look forward to working with you. So everybody have a great day. Thank you.